What started with a first reported death from coronavirus in Wuhan on January the 11th has in less than a year become a tragedy of global proportions. And as the official death toll ticks over the 1 million mark, we're still asking how some of those lives could have been saved, and how we can prevent more loss and suffering. But how accurate are the statistics?
It doesn't get all cases. That 1 million had been reached a little while ago already.
The Johns Hopkins University COVID-19 dashboard receives data from 188 countries and territories on deaths attributable to coronavirus. But some countries are not represented at all, and there's inconsistency among those who do keep a tally.
In a pandemic, especially in a new disease, you don't have a proper testing available. Many infected cases will not be tested and therefore not confirmed. The counting of reported deaths is a key set of data. You know for sure these are confirmed cases of COVID. However, that does not necessarily give the full picture.
Undetected cases can skew the data, for example by making the virus appear more deadly in one country than another. In the same way, people can die of coronavirus without ever reaching a hospital or being tested.
Data is very powerful, but it can cause situations where people manipulate the data to prove their narrative.
Sir, we have the 7th highest mortality rate in the world.
I think it's the opposite. I think we have one of the lowest mortality rates in the world. Could you please get me the mortality rate?
We would perhaps get a clearer picture if every country was like Belgium, hailed as the most accurate and honest in the world at reporting its COVID-19 deaths. The country has been unafraid to feature high in the mortality ranking by counting suspected coronavirus deaths alongside confirmed ones. Bolivia is one country where critics say the toll from COVID-19 is much higher than official figures.
De acuerdo a la Universidad de Johns Hopkins, Bolivia estaría en un quinto puesto de cantidad de muertes cada 100,000 habitantes, con un número de 65 muertos cada 100,000. Si nosotros aplicamos los 20,186 muertos en exceso que tiene Bolivia, como muertos causados por la pandemia del COVID, alcanzaríamos los 174 muertos cada 100,000 habitantes. Esto implica que fácilmente alcanzaríamos el primer puesto a nivel mundial.
Indonesia is also accused of underreporting. Gravediggers in Jakarta say the number of people they are burying has increased 3 or 4 times.
Biasanya rata-rata 10 orang dalam satu hari. Ketika sekarang menangani pemakaman COVID, untuk pemakaman COVID itu sendiri juga untuk beberapa hari terakhir mencapai angka rata-rata 30. Bahkan di hari Kamis kemarin, di tanggal berapa kemarin tuh, itu mencapai angka 40 dalam satu hari.
It's for this reason that many prefer to count excess deaths rather than reported COVID-19 deaths to get at a more accurate tally. Euromomo, the European Mortality Monitoring Unit based in Copenhagen, Denmark, does just that. They analyse reported deaths alongside historical data for the 24 European countries in their network.
What we look at are the total mortality for any cause, including COVID-19, but also any other illness. And what we do is to look at what do we observe and compare it to what we would expect at this time of the year. And that difference is what we define as the excess, and which is largely attributable to COVID-19. So I think the 1 million is an underestimation. We're not sure exactly how much more, but perhaps about 20 to 30% higher than the official number.
If we're having trouble counting how many people have died, can we predict the path the virus will take? Yu Yang-gu set out to do just that in the spring, designing his own forecasting software from his New York apartment. His computer models take Johns Hopkins data and run it through an AI simulator to get a glimpse of the future in 71 different countries around the world.
You need something that is kind of the ground truth and to be able to train your model. And so the best way to do that is to use past reported deaths to forecast future reported deaths. We're currently forecasting about 200,000 additional deaths through November 1st. And so that's about close to around 5,000 a day just for those 70 countries.
Were it possible to factor in all countries of the world, both reported and projected deaths would of course be far higher. So as the official tally of deaths from coronavirus passes 1 million, we can be sure of very little, except that in reality that number was passed some time ago, and that we may never know the full scale of this global tragedy.